And I'm going to go ahead and get started. So, hi, I'm a, well, actually, it's part of my presentation, but I'm here to talk to you about medical legal partnerships. And the one that I manage here at Community Legal Aid, we call the HEAL Project, the Health Advocacy Education. Oh, I think I did that wrong, didn't I? Isn't that funny? The Health Education Advocacy and Law Project. And Dr. Cooper White was there when we named it. And so we've been working with Akron Children's for over 10 years, closer to 12, I think, at least at this point. So who am I? I am a lawyer and a public health person. Those are my passions, and I work at Community Legal Aid. Legal Aid, Legal Aid. We serve 8 counties in central Northeast Ohio. So we cover Trumbull, Mahoning, and Columbiana along the Pennsylvania border, then Portage, Summit, Stark, Medina, and Wayne. So kind of a swath across the state to the Pennsylvania line. Let's see. There we go. What's an MLP? So this is what we're going to talk about today in 15 minutes. What's a medical legal partnership? Why should you use it? How does it help your patients or clients, and how do you make the connection? So, I use this slide just to share with you that it's actually a thing. This is not a new thing. We've been around for. Actually, I was working on early MLP stuff when I was in law school in the late 1980s, and really this model has been growing, and gaining more fidelity and gaining more structure in terms of what works and what doesn't work for over 30 years. So that's exciting. And, it took a while for social determinants of health to catch on, but it's basically what we've been working on from the beginning. Okay, let's see. There we go. There is a national center that kind of helps keep us organized. They're all over the country, and there are some out of the country as well. And there are basically 4 different domains to the work. And the lawyers often will work in this individual space where, like doctors, we're seeing people one-on-one and trying to solve their legal problem. But there's also an aspect of training, right? So that's a little bit more upstream, and so that's kind of what we're doing right now when we talk to folks at medical schools. I also work with pediatric residents at Akron Children's. I've done that for over 10 years. And I do trainings with providers and community health workers and social workers and all kinds of different people to talk to them about how to use the model if they have access to it. And then there's organizational level change, which are sometimes we see that in the legal setting, but also in the medical setting where there are changes to the way things work. Like we just got a really exciting grant to work to expand and modify our integration at Akron Children's Hospital. We're making some organizational changes to that. It's really, really exciting. And then there's policy level change at the government level. And that's really where we're trying to, change things for more than one person at a time, because changing things for one person at a time is very slow for the rest of the people who haven't found you. So I'll talk a little bit more about that after, but I'm going to use these 4. None of them are longer than a minute and a half. They're mostly shorter, just to give you a flavor from practitioners how this model works. And we're going to come back to this how do we help? Let me know, please, if this is not working. And I don't see faces, so you have to. I don't know why I can't find my faces, but you'll have to use your voices if there's something not working. Okay. Let me try this.
Out of medical school, and I was going around and interviewing for residency positions. I went up to Boston City Hospital, and I meet with the chairman, who, as it turns out, was one of the greats of pediatrics. He sits down with 4 of us applicants, and he points across the city, says, "There's a hospital across the city, Children's Hospital, where they specialize in cancer. And here, we specialize in poverty. That's our cancer." There's a whole range of problems that the children I take care of face, And they include things like not having enough to eat, not having a safe place to sleep at night, difficulties in school. Without exception, our families do the best that they can, but they face barriers that are sometimes overwhelming. The Medical Legal Partnership with Legal Aid gives me a partner who is trained in the law. We work together to meet the complex needs of our patients. But the legal aid lawyer can also take the issue to the next level and work system-wide to make changes for the community. Given a choice, I would never practice medicine without having a lawyer by my side. For kids who don't have a lot of economic advantages, there really isn't such a thing as fairness, and there isn't such a thing as justice. For us as doctors, with our partners who are lawyers, we do the best that we can to restore some level of fairness. We never succeed completely, but when we make headway, when we bring a child closer to justice and fairness, I think we serve the greater needs of our society.
I admitted a child to the ICU when I was a pediatric intern at then Boston City Hospital. And it was a kid who had really pretty well-controlled asthma previously, got into the ICU, awful. We were thinking we had to intubate the child. It was so scary. And I was pouring through the medical record, trying to find out why that kid was so sick, talked to the family and said, what was new? That was the fateful question. And what was new was the family had gotten a cat, and I was kind of mystified, right? The family got a cat, but the kid was allergic to cat according to our chart. And I asked, well, why did you get the cat? And they got a cat because they found a mouse in her bed, right? So this poor family was having to make this awful choice, and they had tried to get the landlord to listen to them, and they didn't speak English, and their landlord was ignoring them. And here was this issue where I then was able to help them get the protection of the law because I had a member of the healthcare team that could do that. I had a lawyer that was going to make the landlord make the change. And if you really think about it, like no amount of medicine I could send the kid home with was going to make that possible. The person who was going to fill that healthy housing prescription was the lawyer.
And I'm going to skip this one because I don't want to spend too much time on videos, but I like this one, so I'm going to share it.
So from an oncology standpoint, I just have a multitude of stories of how our attorneys have helped our patients. One story that really comes to mind is a lady who was diagnosed with breast cancer, and she was scheduled for a bilateral mastectomy, and she just out of the blue canceled her surgery like 3 days before the procedure. And the surgeon was very frustrated and said, okay, forget it. I'm going to schedule another surgery. And he just went on with his procedures. Well, we got our social workers to say, well, what's the issue here? Identified that she had just been served an eviction notice from her apartment, and she didn't have anywhere to recover post-operatively. So she said to herself, I can't have surgery because I can't live on the street in a post-op state. And so we got our attorneys involved. They fixed it. She didn't get evicted because they solved whatever the issue was, and she was able to reschedule her surgery, and her breast cancer was cured. I mean, these kind
So that's a great, so those are just sort of kind of quick little vignettes just to give you a sense of it. And I feel like it's better to hear it from practitioners than from me. But that's the idea, right? There are so many things that impact health that are outside of the medical model that make it hard for the medical model, the interventions in the medical model to work. And so it really is this effort of collaboration because neither one is sufficient on its own. And so we use this mnemonic, IHELP, which was on the screen a few minutes ago, IHELP, to think about in what areas can a medical legal partnership or having a poverty lawyer, for example, available to you as a practitioner, where does that help? And the areas, so I is income, right? If you can shore up people's income, it gives them much more stability, and they're able to pay their rent. They're able to buy better groceries. They're able to put gas in their car or keep their car in good repair. And the kinds of things that legal aid does to impact that have to do in large part with public benefits, like are you getting the food stamps that you are eligible for? Are you getting disability benefits, or is your child getting disability benefits if that's appropriate? We talk about cash benefits uh, uh, cash benefits from Job and Family Services, but frankly, there's not a lot of cash benefits out there these days. The idea that you can just go get cash benefits is really false. But there's also Medicaid, right? Medicaid's a big piece of having access to the stability to maintain your health. And the H is housing and utilities. We saw 2 vignettes about housing, right? Eviction and conditions. So it's very clear how that impacts health. Education and employment, we know that having good employment helps you have the tools to maintain health, but also we know that if you can't get through K-12, that it's going to be really hard for you to be a healthy adult, because again, you're not going to have access to the tools that you will need to stay healthy. Legal status, really, we think about that in terms of veterans or non-citizens. And there's a whole range of laws that apply just to those 2 groups. And P, really, we think about in terms of personal and family safety, really in terms of intimate partner violence, domestic violence, stalking, bullying, those kinds of pieces. So that's the kind of the range of things that medical legal partnerships do. And so this is a little bit of a review of what I said when we were talking about the orange wedge. On a practitioner level, we provide training and bring awareness. And at a clinical and organizational level, we become embedded in a process that can address client and patient needs. Right now, we're working with Akron Children's Hospital. We also work with the Summa Family Medicine Center. We work with 2 of the infant vitality hubs in Mahoning, the one in Mahoning County and the one in Summit County, with the community health workers. We've been integrated in and out of several other places over the last 10 to 12 years. And then, as I mentioned earlier, we do some policy work. We have done a lot of work around infant vitality, trying to fill some of the gaps to make people have access again to the conditions of life that will help them stay healthier. Housing has been a huge focus of that. And we are also right now involved in violence prevention, particularly in Summit County. So that's, again, some more examples of that. How do you make the connection? Well, you may or may not have access to a medical legal partnership where you're practicing, or where you have a residency, or for the med students where you're doing your rotations. But you should ask, because there may be one that's kind of tucked in somewhere. For example, like I said, they're all over the state and they're all over the country. And generally speaking, there's a screening process that will help the practitioner identify patients or patient families who have a need that is likely to be amenable to a legal intervention, right? Not everything is amenable to a legal intervention. And so the medical legal partnership works best when it's engaged with a social worker who or somebody involved in the care setting that is aware of how to access services in the community that are not legal, because it's not your best use of resources to have the lawyer trying to do the social work aspect of trying to connect somebody to resources where there's not a legal issue, because lawyers are not actually all that good at that. And believe me, I've tried. And so at Akron Children's, we've just instituted a new standardized work instruction. See, I got that, for how we're going to do referrals. And it's going to necessarily include population health, care coordination, or social work to make sure that the patient and patient family is getting screened for these other non-legal social issues that the hospital social workers and care coordination can connect people to other resources. And so for the people that get referred to the legal team, then we're exploring what the problems are. What the legal problem is, what we can do, What avenues are open. Sometimes there's good opportunities, sometimes there's not. One really exciting change that we have in the city of Akron since the pandemic is an ordinance called pay to stay. And that means that if you're going to be evicted, and the only reason that you're being evicted is because you didn't pay your rent, and you can come up with your rent by the time of the eviction hearing, the landlord has to let you stay. So you have to come up with the rent and whatever late charges there are and whatever the landlord says you owe. But you get to stay, which is a huge, huge shift, right? And for example, Portage or Youngstown, if you fail to pay your rent on time, the landlord doesn't have to take it later, right? They can say, no, sorry, I know you have it now, but I don't want to take it right now. I want you out. And you have no, right? You can't say, but I got it all together now. You're like, maybe your landlord will take it and maybe they won't. But in Akron, they're obliged to take it unless they're evicting you for some other reason. Maybe you destroyed the place, or maybe, I don't know, you have a dog that you're not supposed to have, those kinds of things. So that's kind of the basic structure of the medical legal partnership. How does it help? It helps your families have conditions for health that are not something that you as doctors or pharmacists or the other care providers have that much opportunity or training to intervene on, right? My child is not struggling to breathe at home. We have more money for food. We're able to get into public housing, or my kids and I feel safer in my home. All of those are the kinds of things that make a difference for our families. And let's see. And that's basically the rundown. You got that in 15 minutes. I think I even came in on time. So, which is unusual for me. For those of you who know me will know that. So is there anything, I'm happy to take questions if you have a few minutes for it. I'm happy to say thanks and have a great day.